I'm Grant Blashki. I'm a GP and a mental health researcher, and the purpose of this video is to provide some general outlines about anxiety. It's important that if someone's having anxiety problems that they go and get proper professional help from a GP or a specialist, but hopefully there will be some useful tips from this short video. When we think about anxiety, it's important to remember that all of us have a bit of anxiety, and in fact you need it. You wouldn't bother getting up in the morning or paying your mortgage or worrying about anything if we had no anxiety. So in some sense, that's just normal. The problem is excessive anxiety or excessive worry that starts to interfere with day-to-day life. And there's three main sorts of anxiety which I'll talk about today, but there are different sorts. So I'd like to talk firstly about panic attacks, which are extremely common. They often can occur on their own or in relation to people who are experiencing depression. And the best way to understand a panic attack is it's really quite a terrifying experience for someone where their adrenaline shoots off and they have what we call the flight or fright reaction. And I'll just explain a bit what that is. So all animals, including us, have a reaction when we're in a dangerous situation where we're going to fight or we're going to run, fight or flight. And what happens is all the blood rushes to your muscles and your heartbeat goes up and the blood rushes away from your skin and your pupils dilate. And when you think about it, all these things help you survive, or our ancestors survived when a lion or a tiger jumped out. The problem is that in modern life, that sort of reaction can set off inappropriately to all sorts of situations. And if you speak to people who've had a panic attack, it's terrifying. They think they're going to die, and they feel like they have to escape. They have a horrible experience. So it's not trivial, but the good news is it is something that is actually very manageable. To understand it, the classic sort of cases that we'll see in general practice is people will be in a situation where they feel they can't escape. So a movie theatre or a supermarket or public transport, and they'll get this sort of rush of adrenaline. The other sort of panic attacks that some people have is any situation where they might be embarrassed, so public speaking or, in severe sort of cases of what's called social anxiety, people might not want to even eat in front of other people. So you can imagine that's quite a disabling sort of problem to have. Now, what happens with people with panic attacks is slowly they start to avoid situations where they might have one. And this is why it's so important to get help early, because secondary problems develop. So people stop going to the supermarket, stop going to the public transport, or don't put themselves in a social situation where they might be embarrassed. And so, we really try to manage these problems early on. So it's a little bit about panic attacks. There's more to the story, which one could talk to their GP about, but it's worth being aware of them. They're common and they're one of the most well-manageable illnesses. If you get proper help, you can actually sort those out very well. So apart from the panic attacks that we've talked about, there are other sorts of anxiety, and we won't try and go through all of them, but I'll just mention a couple of examples. Some people experience what's called OCD, or obsessive compulsive disorder. And in this type of anxiety, they have repetitive, intrusive thoughts, which can be really distressing. And the classic sort of thoughts they might have are, I have to keep checking the locks in my house before I go out. Or sometimes the focus is around germs. I have to keep washing my hands, and you have to wash their hands over and over. So you can imagine that would be incredibly disabling in your life. It's very important to get help for that. And I generally, as a GP, recommend people go to a specialist in that situation, because there's some great techniques that specialists can use to help with that. Similarly, just a final example of anxiety to mention is one called post-traumatic stress disorder, or PTSD. And what's happened here is someone's experienced a really horrible event might have been a car accident, or they've been in a war situation, or some really stressful event, and they find that they have to avoid any situations that remind them of that event, and they often have recurring thoughts of that event that can come out of nowhere. And again, you can imagine how disabling that is. As a GP, I tend to send people experiencing this problem to specialists as well, and the GPs will know the local network of specialist providers.